Hi, everyone. Thank you for giving me the chance to come up and join you tonight. I'm from a firm called Better Points, and essentially we are a behavioral change technology company. That's the way we describe ourselves. We work with probably about 20 different local authorities, public transport organizations, NHS trusts, CCGs, as well as social housing associations across the country. And just to tell you a little bit about what we do, and I have to do this because it's actually extremely cool. There we are. I wish my TV did that. So let me describe a little bit of what Better Points is about. Essentially, Better Points is an overall behavioral change system that's a suite of different applications and tools combined with very specifically designed bespoke behavioral change programs. At the heart of it, we've got a digital currency that is called Better Points. It actually has a real financial value. People can't have it as cash, but they can redeem it for things that actually do have a cash value, and they can donate it as cash into charities. Essentially what we do is we actually create localized white label motivational change programs, behavioral change programs. So we have a system portal that can be branded that in according to whatever the colors or the brand are of the organization we're working with, and we actually help motivate real change. So I'm not going to go through every detail today just simply because of the time involved here. It all starts with a core portal, and that core portal can be dressed up in whichever livery of the organization we're working with. The page you're looking at right now is actually something that's from the Birmingham Active Parks program, which is entirely about getting key demographic groups to actually come into one of Birmingham's 60 parks and participate in free activity classes. And there are some very specific target groups I'll talk about how to encourage activity in the city. So it all starts with a portal that gets personalized, gets customized to a key program, and people will sign up through this portal. But the key thing we're actually looking for people to do is we actually want people to download an app. And that app is currently on Apple as well as Android. And that app, when they download it and they put in their email address and their name and their postcode, it becomes personalized to where they are. So for example, if I bring up my app right now, and you can't see it, but when the app opens up, there is a whole range of content and articles that is very specific to the geographic area we're in. So I can look right now, simply because I'm in the West Midlands, and what does come up are specific articles and content about the parks in Birmingham. Okay, so the other thing that happens on the app is once you download the app and you have it active and you allow GPS to occur in an area, any geographic area they're in, there will be activities according to who you are. So for example, if I'm with a specific, if I'm in an over 65 group that's part of a social prescription program, say in Birmingham, there will be specific content geared to me, and then there'll be specific activities. I might get points for going down to the community center. I might be getting points for going for a walk in the park. I might be getting points for joining a social event. So all of the key activities on an app are one of three things. Something that I can personally do that I will earn points for, and hopefully that is actually a very positive choice I can make. Something I can share. So for example, I can invite somebody to go to an event with me, and because I take somebody with me, we both get the points. Or I can actually join into something. So I can join exercise class. I can go down to the community center, and I can actually participate in activities down there, and somebody will register me to join in. Okay, so basically anything that you can think of that would actually create somebody, motivate somebody for a positive choice, we can generally put it up as an activity. So what I've been waving with my hand is exactly what's up here right now on the screen. When you come in, you will actually see that there's a range of activities, and all the user does is they just push a button, and then it registers exactly where they are, what they're doing. So things like cycling, walking, car sharing, riding the bus, riding the train, losing weight, and the app is also capable of answering questions. So we have a program in Northern Devon called Make Way, where people can actually register their weight that they currently are and answer some multiple choice questions on the app on a real-time basis. So once they actually earn points, they can actually redeem them for specific rewards that are okay for each program, that are personalized to each program. In this case, I see a 2 pounds Debitum e-card for 2,000 points. They can get an e-gift card to come to, which is a digital voucher. Or else they can actually get paper vouchers that we put in the post to them. And then on the app, we have over 10,000 charities on our database, including a lot of just local community groups. So where they are in terms of postcode, they will have relevant charities pop up, and they will be encouraged to download those points as cash to charity. The other thing that happens with the app is we can reward in different ways. So we can reward somebody for actually going 1 mile, and they might get 20 points. If they go 5 miles for a walk, they get 150 better points. Or we can do it on the basis of time. Come downstairs, go for a walk on the high street for 20 minutes, get 50 points. So in other words, we can construct any kind of activity event according to duration, according to distance, or according to event. Somebody can one of the things we're doing, for example, in the New Forest right now, is encouraging people not to take their cars anywhere into the New Forest. So we're encouraging walking, we're encouraging cycling, and there'll be posters along the way that people can scan a QR code and receive points. We can do the same thing with community centers. There's a number of well-being centers right now in Birmingham where you'll see pop-up stands where people who come into those well-being centers scan the QR code and register points just to show that they were there participating. The system actually, in order to make this work, we actually do have a very specific platform. There is a content management system. We actually provide our partners with access to that content management system. But the key thing I really wanted to show you here was that because it's GPS enabled and because everything we do is digitally captured, everything we do is evidence-led. So you can actually see the results as they happen. If you don't, so let's say you're looking after a particular demographic group. In Gloucestershire, for example, we're about to start specific activities for 1,079 dialysis patients. Okay, so we can actually look at that group as a specific group activity type and see whether or not the actual activities are being used and how people are responding to that. And we capture information in the profiles, we incentivize people to answer surveys and to tell us how they're perceiving things. And we can change things on a real-time basis. So the key thing I wanted to share with you today from a behavior change standpoint, it's not like we just decided we're just going to create some activities and throw some points on board. And there's a reality about incentives. I don't know how many of you might have a Tesco Club card or other reward programs, but the reality, a lot of reward programs, they simply encourage people to repeat a purchase. And then if the incentives or the rewards stop, the points stop, they're happy to go someplace else. That's not behavior change. So what we actually have is we have a behavioral change approach that I want to spend a couple minutes to take you through. That's actually based on a lot of the behavioral change models, a lot of the behavioral science models. So the first thing we're trying to do in any program we're doing, whether it be Make Way in Northern Devon, whether it be the Active Parks program in Birmingham, whether it be the Think Travel program in Gloucestershire, we're trying to make specific groups of people, targeted groups, aware of a specific situation. So for example, it might be people not really understanding that they actually are a little bit overweight and they need to exercise. So we then actually inform them, well, what if you actually did this activity? What could be the impact? How could that actually help you? Or what might happen if you actually just started walking that last bit to work? How could that actually help you? How could that actually help travel in your town as well? And then we use that to create activities which specifically motivate them to try it for the first time. And there's key things here. It has to be easy. If you're trying to get people to do things like don't take their single car journey, but actually walk to work instead, it's got to be really easy. It's got to be fun. So it's as easy as just literally pushing the button and walking, and the app does the rest of it. The other thing that happens is once they've done that, they can actually see the journey they took on the map. They can see instantly how many points they've won. And then we actually push messages to them. Wasn't that good? Did you enjoy doing that? And we allow people to socialize it on Twitter and Facebook automatically, so they can go out and socialize it with their friends on their networks, and then we actually encourage them to start it again. Now we come to this next bit, which is critical for the behavior change. If it's just pure economic incentive, it won't work. The key to success here of making this happen, obviously it has to be things that they enjoy doing, but it actually has to be things where they can socialize it, they can talk about it. Like I go down and I earn points for volunteering at the Ready Foods food bank in Reading, and I meet people, and I get involved with people, and I share stories. And so there has to be some form of emotional, people-based engagement, some form of emotion, and it actually has to lead into some sort of ongoing personal engagement. It has to be relevant to them where they see a personal benefit, an emotional benefit to their life. If that does not occur, then the behavior probably will not sustain once you take away the economic incentive. Now, sometimes people learn new habits, and we can go into all that, but the key thing is that people have to see the benefit. So our entire system is if you look on our portal and through things, you'll see how we actually take the steps to build awareness, to build socialization, et cetera, et cetera. So the question really remains, I know we only got a minute left, is this doesn't seem to be working yet. Okay, let's try this. Let's keep going. Okay, so there's a whole thing. I know I don't have much time. Very briefly, I just wanted to say, be very careful with the use of incentives. If you're looking at behavior change programs, sometimes incentives can backfire. There's such a thing called price effect. And what price effect is, there was a school who got very tired of parents dropping their kids off late. So they just decided they were going to charge the parents £5 for every day that the child was late. They dropped off their children late. What ended up happening is they all started dropping off their kids later, more frequently. And the reason was because they priced it. To the parent, it was what you were saying, hey, it's okay to drop off your kids now. It's only going to cost you £5. So sometimes you can actually also hurt people's image. So we started attaching points for volunteering when we started, but unless people realized that they could use those points as cash to donate for charity, some people were insulted that we were actually trying to pay them to volunteer. So there has to be something. You have to be careful that you don't do something wrong with people's image. Does that make sense to everybody? So we try to watch that very, very well. And let me just show you a couple more things. Does it work? This is the example of the Birmingham Active Parks program that we have been now running since September 2014. So this is motivating activities across all 60 of Birmingham parks. And there's Tai Chi classes, buggy fit classes, senior walks, you name it, there's an activity. It's also with the leisure centers increased. So what we've been able to do is we've actually had over 2,000 people sign up. We went from 15 people in month 1 to over 230 in January. One of the key criteria for continuing this program is we had to prove that we could acquire people in the most deprived areas. So over 50% of the people who've enrolled in this program are from the 30% most deprived areas in Birmingham. More than 50% of the people in this program are actually from the most deprived health domains in Birmingham as well. The other thing that we've been able to prove is in the period from March 2015 to December 2015, an active user in this program moved from 20 activities a month to over 60. So that's over a 200% increase. And we spontaneously get letters all the time from members. People actually have lost a lot of weight. We've had cancer people recovering from cancer. We've had women come in who refused to go to the parks before because they'd been sexually assaulted. They were able to come up and share points and go out for walks together. We've had a lot of very exciting results. So this is something, I'm going to stop there, but this is something that we started as a program with a charitable trust about 5 or 6 years ago. We believed that something had to give. We saw the pressure coming on costs, on the healthcare budgets, on the local authority budgets. So this was our brave solution. What can we do that's actually really cost effective, that's really positive? So if you get people walking to work, that helps their health. It also helps the town. So a lot of these things have more than one payoff. So I'm going to stop there. But thank you very, very much.